a lot of people who went through these challenging circumstances, what sort of system now that we have in place for the mental health of the affectees?
A lot of affectees have actually also now in these 2.5 years have gone back to their original places. They're not in camps. I think that's important to establish. And I know we were having a conversation about where these people are now.
Yeah.
So majority have gone back to their lands, and there are people in minority who have decided not to go back to their original lands and go someplace else. But again, that's also linked with a lot of displacement and internal migration that's coming towards climate change. Why would people want to come to their area again and again? If you talk to the people, it's their home, inki mitti hai, it's where they've grown up for generations. Also, they don't have options. That's important. In order for people to change, they need options, which are not available. Now, so first precedent to set is that where are these people who need mental health? The majority are back in those areas. Now, do we have any mental health facilities? Let's talk about first the government. Most of people would have access to government health facilities, basic health unit, then the rural health center, which is, if you look at the infrastructure of the health system of Pakistan, it starts with your basic health centers. Now, as I said, these areas, they were already at the lowest of the low, and health was never a priority here. Or when I say a priority, let me rephrase, the health infrastructure was really poor here. Your basic primary health service delivery was non-existent. So now mental health is another layer that we've added.
Right.
Let's also consider that who are the frontline health workers. It is Our Lady health workers, it's Our Lady health volunteers. They are community volunteers, in some areas called Marvi workers, or just like community volunteers, a basic definition. Let's say if you and I live in a community and we are proactive members of that community, you and I could be trained on a few basic concepts, and we would move around in the community, give some guidance and counseling to people in the limited scope of ability that we have. So important to consider that these are our frontline healthcare workers who we've now given an added responsibility from vaccination to immunization to, let's say, family planning, basic health service delivery. Now we say, hey, you guys do mental health counseling as well. Now that's not possible. And those people, the frontline workers, are not equipped or prepared at all. Do we have mental health clinics or specialized people? There are very few. Actually, at the grassroots level, it's almost non-existent. And that is a huge area where civil society, where researchers, academics, private institutions, private accredited certified institutions can have a huge role. Now in Pakistan, it's very easy to get a certification to be a therapist, but of course we want some people with quality and experience. That's another dimension to look at, that if you're giving services, are those services and people qualified? That's an important thing. Again, as I said, demand and supply. The demand is there from people, but the supply and infrastructure is not there.
Right.
The government's still focusing on primary health services. This is an added thing that, but they have not been able to mainstream this in the primary health care agenda. There have been other service providers. We call them service providers, basically. So we have mental health service providers who would come, and most of the ones who are working, they are run by NGOs, INGOs. They are activists, they are academics or practitioners who decided that they want to volunteer. We don't have that system. Digital health or telehealth could be a very interesting model.
Right.
To link up people and communities. But again, do we have good infrastructure? Is there good internet? Everything that you offer, you have to give an enabling environment as well. But mental health still not a priority. There's a lot of work that needs to be done. When the floods came, there was a lot of discussion. Some people came there, but you see, emergency is just for 3 to 6 months. That emergency quick response, it's only a few months. It's not going to last for a longer time. When you say mental health support, that means more than 6 months, 1 year, 2 year, 3 year, 5, embedded in the community. That's another thing to realize, that whatever we do, community needs to take ownership. You and I don't live in this area. The people who do, you need to build systems or empower them, enable them, train them, incentivize that process where they become those activists, they get those skills, they give those services to the people themselves. Either people will give services, or you'll have government or health system to give services, or you'll have private healthcare providers.
Right.
But private healthcare providers are expensive. So will people have money to afford that? And the answer, of course, is no. They can barely afford private healthcare services from primary services, let alone go to a mental health specialist. So this is a whole Pandora's box that needs to be looked at. from demand, supply, policy, regulation, pricing mechanisms, what services are being offered. Schools could be one good medium for children. Again, functional schools. So, of course, where's a functional school? But then who will bear this responsibility? A teacher. Teachers already are doing multi-grade teaching. So one teacher is teaching all the subjects. Now we've said to this teacher, hey, listen up, now you do mental health as well.
Yeah.
That's not possible. You've given him or her that burden as well. So this conversation or this mental health crisis that is happening and will happen continually because, of course, floods, devastation, it's always going to happen. This needs better planning and management at many different levels, from disaster response level, which is the District Disaster Management Authority, the health sector. The primary custodian of health is the government, the district health department, they need to be involved. But then another thing is, how much can the government do? They're also overburdened, there's resource gaps, there are human resources challenges. So other people, as I said, service providers have to fill in that gap. But are they qualified? That's another thing. What services can they offer? Are those services effective? Are they in context of the people? Are they looking at people through the gender lens that we talked earlier on? Are they also looking at people with disabilities? Everything is connected. So to answer this question, it needs more dissection and analysis and a deep dive on how we are prepared to give better mental health services to people already affected. It's been 2.5 years and for the future.
So what I understand is that there has to be like a consistent effort and it's going to take a lot of time.
Infrastructure is not yet in place.